Out of the woods when it comes to COVID. As we deal with climate change, as we deal with a number of other challenges, we have to always keep in mind that the need to wear your mask, to socially distance, and to even be just reminding ourselves and being a little bit more diligent throughout this process is necessary, because we are also focusing on making sure that as we reopen, that we don't turn back the clock. You all remember what happened last time a couple of months ago when one day I announced that we're going to be opening a number of places, and as of today, some of those places are open and some of those places still are not open. But we do have some good news in that our hair salons or nail salons and other places that clearly, from my perspective, can hardly operate outdoors are actually able to finally operate indoors. That is a huge step. We don't want to turn back the clock. So I know those businesses are going to be working hard to stay open. They're going to be following the guidelines, and we need your cooperation too in not only supporting these businesses and following the guidelines within those businesses, but following the guidelines outside of your everyday life. This is just what's necessary in order to make sure that we don't turn the clock backwards. So we know that there are a number of places that are now able to operate, including salons and massage locations and nail places and barbershops. Next week, we're hoping that our museums will start opening. We've expanded the capacity of churches outdoors. We know that this is not enough. We want to do more, and everything is contingent upon where we are with the numbers. Yesterday, there was just a slight glimmer of hope when we opened the learning hubs. Kids were able to come together in these environments within their cohorts, and they were able to review their lessons and do their socially distanced learning with people who can help them, and they were also allowed to play together. We still have not opened the schools, but we're hopeful if we are able to maintain the numbers that we will get to a better place and our schools will be able to reopen. This is progress, but it's not enough and it's not certain. The only way that we continue in this direction has everything to do with each and every one of us. We know that small businesses are also having a real challenge. And what we've been able to do from a city perspective is to provide financial resources early on, to delay a number of fees that the city charges. We know that we need to do more, and we know that at the end of this month, the eviction moratorium on commercial evictions will expire. And the way that we are able to extend that depends on the state, it depends on the governor, and we are in close contact with the governor's office to try and ensure that that is extended. We know that people are anxious, especially those that just had the opportunity to reopen. They want certainty about the future, and we want to give you that certainty and we want to give you that flexibility. So as I said, we are doing everything we can to work with the governor's office to make sure that we're able to extend that, just to give small businesses a little assurance. We know that before this pandemic, small businesses were suffering, and we have a number of initiatives that we're putting forth to make sure that we provide some level of financial support, but also some level of financial relief. It is very, very challenging. We've already seen hundreds of businesses throughout this state close their doors permanently. And we have heard from so many other struggling businesses and industries that they're just not going to make it. And when we look at the economy and the challenges that exist, I know that we need to do more, and we are working on doing everything we can. So with that, I know that people are pretty much tired of what we're living in as it relates to COVID. I'm tired of talking about it. I'm tired of living in it. I'm tired of doing all the things that you're tired of doing, because I want to enjoy my life. I want to live. I want to go back to normal. But unfortunately, this is a deadly virus, and it has a significant impact on the most vulnerable, including our elderly. What we don't want to see is our bad behavior impact them. We don't want to roll back the clock. If I know anything about this city, we are a resilient city. We can sacrifice this time for a better future. We can sacrifice this time to get to a better place so that kids are returning to school, so that we're able to visit our elderly parents and grandparents, so that we're able to hang out with our friends without wearing a mask. But right now, it requires sacrifice. There's a lot of sacrifice going on. There's a lot of uncertainty. The air quality last week, I'm sure, created a lot of fear in all of us. We were wondering, what is going on here? We've never seen the likes of a global pandemic, an orange sky in San Francisco because of what is happening with wildfires. 3 million acres burned in this state. Some of the deadliest wildfires in our history. So many things that are happening. And we are all wondering, what is going on? Well, what is going on is there are real challenges that exist. Climate change is real. There are things that we're going to have to do that we've never had to do before. But we've been through challenging times in the past. When we went through the '89 earthquake in San Francisco and our city fell apart, we got through it. When we went through 9/11, which we just celebrated the anniversary for, even though it didn't directly impact San Francisco, it directly impacted life in the United States of America as we know it, and we adapted and we got through it. We've been through challenging times before, and we will get through this challenging time once again, and we will look back on our time and think, wow, if we can get through that, we can get through anything. And it also will make us a stronger, more resilient city. This time is really testing our ability. It's testing our resolve. And if I know nothing about the people of San Francisco, I know this. I know that we are strong. I know that we are fearless. I know that when things happen in San Francisco, the rest of the country follows. And so the work that we have done here in really reducing the number of deaths and being the first out of the gate to say we're going to shut down, and being leaders around greenhouse gas emissions and combating climate change head on, the work we've done around eviction moratoriums, and you name it, we have been the leader and others have followed. And so we will get through this. It is going to require a lot out of each and every one of us. And so I ask you to continue to do your part and to remember what you do impacts me, what I do impacts you. We really are in this together. Thank you all so much for all that you do to keep this city going. It's a challenging time. It's time to uplift one another. It's time to focus on being positive. It's time to put some good energy in the air. Enough with the complaints. Enough with the negativity. Enough with the divisiveness. We have an opportunity to be better than that. We have an opportunity to do what we did in the beginning of this pandemic when there were notes given to neighbors that said, what can I do to help you? We have an opportunity to do more for one another and to put goodness and positivity in the air. We're not going to get through this on our own. We're going to get through this together. And I'm counting on each and every one of you to do your part. Thank you all so much. And at this time, I want to introduce the Director of the Department of Public Health, Dr. Grant Colfax.
Good morning. I'm Dr. Grant Colfax, Director of Health, and thank you, Mayor Breed, for your remarks and your ongoing leadership during this unprecedented time. This week, some of our local businesses opened their doors for the first time in many months. I want to acknowledge the sacrifice and perseverance of their owners and the employees. Thank you so much for helping make our community safer during these past months. As you reopen, thank you for keeping safety at the forefront. We are indeed in this for the long haul. Whether we think of this as a marathon or a multi-inning game, our perseverance, our resilience, and our hope is necessary for us to carry forward. For us to continue reopening San Francisco, to carefully add limited indoor services, to bring children back into classrooms, to rebuild our economy as safely as possible, we all have to remain vigilant in our fight against this virus. And we do know more about the virus today than we did 6 or even 3 months ago. We know more about the data, the science, the facts, including the risk and preventative measures we can and must take to continue to slow the spread of the virus. It is why San Francisco's approach has been to open incrementally so that we can manage the spread of COVID-19 as much as possible and sustain the progress that we have made. As we continue to reopen schools and indoor businesses, even at limited capacity, it is important that we continue to monitor the virus. We do this by tracking our local COVID-19 data. The 5 key health indicators, which I encourage everyone to follow online at datasf.gov, tracks data linked with keeping the healthcare system stable and managing our rates of infection. iLook, the health department, many of us across the city, because I hear from you, look at this data closely on a daily basis. It helps drive our decisions on reopening San Francisco. So let's take a few minutes to look at some of these data with regard to where we are today. We have had 10,430 San Franciscans diagnosed with COVID-19, and sadly, 91 of them have died. My thoughts are with their loved ones, friends, and community. We also know that 51% of our positive cases are people who have identified as Latino. But let's look at some graphics. Here is the number of, let's go back to that first slide, please. This is the number of COVID-19 cases diagnosed in our city at this time. Our case growth remains stubbornly in our red zone at about 61 new cases a day. This number has been slowly trending downward for the past few weeks, but we must remain vigilant. And I must say, with Labor Day and the crowds, we must continue to mask, to socially distance, to avoid mass gatherings whenever possible. We know from the data that this virus is responsive to our prevention measures. If we are careful and thoughtful, if we get to that 80% masking prevalence, if we keep 6 feet apart, if we avoid large gatherings, the virus slows down. And if we don't do those things, the virus speeds up. It's really that simple at this point. Let's go to slide 2. This is the history of hospitalizations of COVID-19 patients across our hospital systems in the city. Again, these data are available to review on our data tracker. But you can see that our hospitalizations are starting to rise again on that far left of the slide. We have had a 29% recent increase in COVID-19 patients in San Francisco hospitals recently. We do have sufficient hospital capacity for them now. And this is one of the key indicators that we monitor very closely. I also want to take a moment just to emphasize the pattern that we see on this slide since the beginning of the pandemic. San Francisco, we didn't just flatten the curve, we crushed the curve. In May, seeing those numbers go down to a low of 26 in June. We saw an increase, that surge that we talked about, starting in late June, early July, peaking at 111 hospitalizations. That number started to go down again. We went down to 51. We are starting to see an increase again. But we can do this. We've done it twice. We can do it again. Let's flatten and crush that curve for the fall. Next slide. With regard to testing, we are now testing an average of more than 3,400 people a day for COVID-19. 3,400 people a day in San Francisco are getting tested for COVID-19. That's nearly twice our goal. We are following the virus and targeting our testing where the virus is most common in the city. We are focusing on vulnerable populations and people who are exposed to the virus, and as always, people who have symptoms. And within our city testing system, I am pleased to say that our turnaround time for test results is down to less than 1.5 days. Our other COVID-19 indicators in case investigation, contact tracing, that personal protective equipment or PPE remain steady. It is still our goal to reach 90% of people who test positive for COVID-19 and 90% of their close contact. Recently, it's been closer to 82%, but we continue to make progress towards that ultimate goal. We have 100% of the personal protective equipment we need to protect healthcare workers and first responders in addressing COVID-19. And because 51%, over half of COVID-19 cases are within the Latino community, we are working to continue to bring resources, particularly testing, contact tracing, isolation and quarantine, and other all-important wraparound services to this community. We currently have mobile community testing sites, low-barrier testing sites, in the most impacted neighborhoods in the city, including the Mission, Excelsior, Ocean View, and Bayview. We will continue to bring more testing resources to the southeastern neighborhoods of the city. And we have expanded our contact tracing team to include 50% of bilingual speakers, and nearly half of our isolation and quarantine beds are occupied by people who identify as Latino. But we must do more. And DPH has committed to more services and resources to serve those communities that are most impacted by the virus. As we learn more about this virus, we will be targeted in our response as well as our reopening. We know that indoors is riskier than outdoors, which is why indoor services and in-person learning remain limited. We know that mixing households in large gatherings is risky too. And once again, we know that face coverings make so much difference. As people continue to move about the city and increase activities, we will likely experience an ongoing increase in cases. And to keep this reopening to keep it moving forward, we need everyone's help to limit that community spread. Our progress, our hope to be able to do more on reopening depends on you, on me, and on all our neighbors and friends. Please keep washing your hands. Keep covering your faces. Find ways to connect with families and friends while keeping 6 feet apart. This is how we have, and this is how we will continue to protect San Francisco. This is how we get San Francisco back on track. Thank you.
Thank you, Dr. Colfax, for your time. At this time, we have a few health-related questions for you when you're ready.
Thank you.
The first set of questions are from Ida Mojadad with the San Francisco Examiner. The CDC just issued a report about Utah, where children in school settings spread COVID to their households. How will San Francisco ensure the same doesn't happen here with schools opening in person as soon as next week?
Yes, well, we continue to review the data with regard to school reopening, and we are working very closely with educators and schools to ensure we can open as safely as possible. Look, there is risk, and I would not be surprised, even with the cautious measures that we're taking, that there will be COVID-19 cases diagnosed in school settings. But we're doing everything we can to mitigate that risk. We have a number of schools who have applied to reopen. They are required to have safety plans. We are visiting schools to ensure that things like ventilation and classroom structures are able to open as safely as possible. And we will continue to work with the school systems and educators, again, to ensure that opening can be done as safely as possible with the many precautions that we know do slow the spread of the virus. But this is the time of living in a situation with COVID-19, and there is risk. There is no way to completely eliminate that risk in the settings, including educational settings.
Thank you, Doctor. The next set of questions are from Alexander Barrera with the San Francisco Business Times. Dr. Colfax, do you anticipate indoor dining will be allowed at any capacity before the end of next month? If so, what criteria are you using to determine whether indoor dining is safe enough to be allowed?
So again, we're reviewing the data on transmission of the virus in indoor settings, including in potential dining areas. There was a report out from CDC with regard to the risk of transmission associated with dining, so that gives us pause. We are working with restaurant industry stakeholders to determine what safer reopening might look like, what that capacity would potentially be, and we'll hopefully have more information to share about the potential timeline for any type of reopening for indoor restaurants. I would obviously emphasize that outdoor dining and takeout remain available and open in San Francisco.
Thank you, Doctor. The next set of questions are from Christian Captain with KTVU. Are we seeing any increases in COVID rates that may be attributed to Labor Day activities?
So we will continue to watch these data over the next week or two to see if we do see an increase. We did see an associated increase in cases a couple of weeks after Memorial Day. So monitoring that very carefully. I would also emphasize that the hospitalizations are people who become diagnosed with COVID-19. If they are going to end up in the hospital, that's usually a couple of weeks after they are infected. So that hospitalization rate is delayed a couple of weeks compared to the case rate. So we are looking at both the case rate, which will show up sooner with regard to the Labor Day activities, and then that hospitalization rate would most likely increase a couple of weeks after that. We're concerned, we're watching it, again, so much depends on people wearing those face masks, social distancing, and avoiding large crowds whenever possible. This is eminently doable. We know what works at this point. We just need to all do it.
Thank you, Doctor. The last question is from Amy Graff with SFGate. San Francisco has the lowest rate of COVID-19 deaths per cases of any major city in the United States. How has San Francisco been able to keep its death rate lower than other cities?
Well, I think there are a couple of things. One is that, and I really want to express gratitude to the hospital systems across the city, the hospital leadership across the city, the health systems, which really came together early in the pandemic, and we figured out how to coordinate together and be as responsive as possible to healthcare needs in terms of the intensive care units and the medical surge beds that would need to be available. The other piece is we have world-class medical facilities in the city, and literally the state-of-the-art care for COVID-19 is being done here. So I think we have excellent care facilities, and we also have, compared to other cities, excellent access to hospitals, including at Zuckerberg San Francisco General. So while there is more to be done, our access to healthcare, to testing, to hospital systems is very high compared to other jurisdictions. So I think it's a combination of factors, but I'm so grateful to the fact that we do have a lower death rate, and let's all work to keep it that way.
Thank you, Dr. Colfax. There are no further questions at this time. And that concludes today's press conference. Thank you, Madam Mayor and Dr. Colfax.
A 100%.